Buenas tardes. Good evening. Good evening to all of you all over the world who are listening to this presentation today, this Dr. Mugüerza's clinic. Welcome and good evening if it's evening wherever you live, and good morning if you're listening to this in the morning, and good night and good evening again if you're listening to this at night or wherever. It's a pleasure and an honor to be here again today. It's our third chapter of the Dr. Mugüerza's clinic on the internet. We are very happy with the results, with the outcome. There's been a lot of people attending our sessions, and we are getting a lot of good feedback and a good connection with our attendees. So we are really happy to be able to do this. As you see, the company, the screen has grown a lot of information, and let me show you again what's this information here. And here are, how do you see this here? On top left, you have seen that we're live now. That this is happening now in Valladolid at 4:03 Central European Time. That this is Dr. Mugüerza's clinic. Dr. Mugüerza's clinic. This is, and the company which organizes all this is TranslaStars. TranslaStars.com. I deeply recommend you to visit their website and learn about the enormous the variety of activities, courses, webinars, boot camps, mentories. There's a lot of possibilities. Probably this is the largest company now offering this kind of services. And on the CEO, which is a very close friend of mine, Alfonso González Bartolesi, and all his team are working continuously to offer all different varieties of courses and webinars and the boot camps, as I told you, and many other activities. Please visit that page and learn about what they offer, and the prices are also very competitive. When there are many free options, there are many things you can just subscribe for free, and others you have to pay, but it's really competitive. So visit that. As you can see now, we have grown this other signal here, JustPoint, or JustPoint, as we say. JustPoint is a company of translation management software, and I would also recommend they are sponsoring us, and we are very grateful for that to them for that. Thank you very much, JustPoint, for this sponsoring. All other companies are invited to sponsor us, or maybe make your advertising in our screen as you are seeing it, or you maybe want me to talk about your product, or you have a book or a course that you want to sell here and recommended by me, which, believe it or not, I have some prestige in the medical translation community. So maybe you're interested. JustPoint has been interested. Visit their website and learn about how they, of course, they offer the CAT tools, the most common CAT tools, but also programs for invoicing, or software for invoicing, or for managing projects. Or it's very, very interesting. They are quite new, and probably people, particularly in Spain and Argentina, will be interested, but also in other countries. It will be very useful. And let's finish with the screen here. This is the most important for me here. What you see here is that next Monday, we begin our bootcamp in English, Fundamentals of Medicine for Translators and Interpreters. Listen to this. If you know me, or you've are trying, are looking your way in your career in order to be a good medical translator, you know that you need a medical background. It's if you maybe probably you're a great linguist. You have studied a lot. You've gone to university. Then you have a master. You're a doctor. Maybe you have a PhD. But have you really learned medicine, basics of medicine for to have a background for translation and interpreting? Probably you haven't, and I am offering to you through translators. We're offering to you a very short course. It's only 10 hours, 2 hours every day from Monday to Friday, at a very, very, very competitive price. Really, if you're living in Colombia or Peru or Chile or any player in South America, you will find it affordable. And of course, if you're in the United States, it's inexpensive, completely. It's cheap in a way, in a good way, and also for the Spaniards. So I will be teaching these classes, and I will explain you medicine, but for you translators. You may often, there are no many offers of companies offering fundamentals of medicine for translators and interpreters. There are a few, not many. And the teachers there, the tutors, are physicians, right? Very good physicians with a high performance professionally, and that they are authorities in their realms, but they are only physicians, right? They are not translators. Here at translators is the only place where you will find these fundamentals taught by a person, me, who is a physician and a translator. So I will, when I teach to you, let's say I talk to you about how to say the liver, I will not say, liver is here and this is the parts of the liver, there are lobes and there are lobules and there are the tree and the conducts, the ducts and no, I will teach you that, but besides the problems of translation and that particularly liver in this case, right? So it's the best way. I believe me, I spend the rest of the year asking questions for people. Where can I get my medical background? This is your opportunity. We will do it in English starting this Monday, and we will do it again in May, approximately the 18th or the 17th. I don't remember exactly the date. We will do it in Spanish, and so it's up to you. You have it in English and in Spanish if you want, and it's always me, always teaching from that point of view. People who has a lot of I've done this many times. Unfortunately, I have had many attendees, students, people, and they always say, you know what, with Pablo you learn, of course you learn medicine, you learn the difficulties, and you enjoy it because I have a way to explain things that you will not get bored. I It will be a good time together. So please join us in our boot camp starting next Monday. There are few seats available yet. We cannot accept everyone who comes because we have only a limited number of vacancies. So please don't hurry up and inscribe yourself. On this boot camp, and let's start with today clinic, with today consultation, with today office, and as you probably know, what we do here is that we share. Let me see. How here it is. We share these screens, and what I try to give to you is every second Tuesday of every month. We will repeat this in May and in June and July, August. Well, summer. But we will try to do this because we like it, and we are getting such a good response from you that you deserve this. Today's spiel is the core of our Dr. Mugüerza's clinic. Our intention here with this Dr. Mugüerza's clinic is that you make questions about our profession, right? That should be the core. And I don't know why in the first two editions of this these episodes of this Dr. Mugüerza's clinic, you didn't really interact a lot with me, just made a few questions. I'm sure you want to know, and you have questions about the relationships with clients, the rates, how much are they paying now for translating, which is the future of automatic translation, for instance. If you want to know my opinion about that, or maybe it's not an opinion, it's an answer, please use the chat and and we have here that we have a Ramona Mona and Ramona Mona. Hello from Madrid, and early happy birthday to your dad, if I remember rightly from the. Oh my God, Ramona, you really have a memory. Yes, my father's birthday is on Thursday. I have sent today a present for him. Thank you, thank you. He was born on April the 14th, which in Spain is an important date for part of us, because it is the anniversary of the Second Republic in Spanish. Before the Civil War, we had the so-called Civil War from 1936 to 1939. But before that, we had a genuine democratic government, won an election, and we had the Second Republic. We were a republic, and it was the Second Spanish Republic. And the anniversary is on April the 14th. For those of us who believe in republic, it's a great date. And also, it's my father's birthday. He will be 89. He is in a very, very good health state. So to me, it's a great honor to talk about him. He's, of course, the greatest man of humanity. I've never met anyone better than him. And I'm very happy that he's getting old and wise and sharing his life with us. Thank you, Ramona. And let's go with our appeal for today. If you've seen the publicity, anyone can discourse. This Paula. I don't have experience with translation, and I want to be more professional about it. Of course, Paula, anyone can do a discourse. I'm talking about anyone who has a academic background, right? I hope you. Sorry, I don't want to be rude, but I understand that you have some academic. If you have just left high school, maybe it's a little bit. But I think it would be. Anyone would be interested. Anyone who is interested in translation would be interested in my boot camp. It's the level is very wide. It can interest you despite your level of knowledge, right? Even if you have some knowledge because you're a nurse, maybe you're a nurse, right? And you say, well, I know the fundamentals of medicine, but you don't know how the problems of translating that, and that's what I teach you. Right? At the same time that I explain you how lungs are, how is the stomach, how is the brain, how is the throat, how are the feet, how are the legs, how is the heart. It's very fascinating learning about the heart. At the same time, I will give you very basic information, but always trying to fill the gaps of ordinary information. All of us have an idea of how the heart works, right? Okay, I will fill the scientific gaps missing there at a very, very affordable level, and at a very affordable level, and at the same time you will learn the problems of translation. So, Paula, I deeply recommend you to join us in our bootcamp. If you've seen the publicity of today's clinic, I've been talking about the modal and defective verbs. This is if it is the first time you attend to one of my presentations, you will know that I always are very quite plain, right? I'm not sophisticated. I can be sophisticated if I want, but I try to be very down to earth and try to explain things that can be interesting to those who are starting and to those who have some experience. Maybe if you have a lot of experience, maybe you will find this despicable. No, you don't need it. But I follow many translators on the internet, right, on the social networks. I'm in contact with many professional translators who are talking every day about, I'm translating a protocol, I am translating a medical report, I am translating, and they have never joined my courses because they probably consider that they know more than what they need, than what I teach here. No, that's wrong. What I teach here is filling the gaps of academic teaching, academic education. I know enough to be aware of what is lacking in that conventional how do you say, development, right? Professional development. That I know enough to know that, to be aware of what you need, to what is lacking there, which are the problems of our realm, of our specialty. For instance, in this case, I will assume that you already know very well what defective verbs and modals are. Now you know that defective verbs are verbs that don't exhibit all the typical forms of a conventional verb. In English, the English modal verbs, as you probably know, are do, shall, will, can, may, let, must, ought. Those are the defective verbs, and they are all the time in medical English. That is what is. That's why I bring them here, because medical English is a very possibilistic. I've called it, I think there is a definition of possibilistic somehow. No, I didn't. Sorry. Eventually didn't. Possibilistic is not in the dictionary, but it's something when you speak a language and you only explain possibilities. You don't make statements, positive statements of what can be do, what cannot be do. That's a very important characteristic of medical English. You will not find, from a grammatic point of view, you will not find sentences. It doesn't matter which type of text you are translating. Maybe a protocol, maybe how do you call this? A summary of product characteristics, maybe a label, maybe an investigator brochure, maybe a leaflet, a package leaflet. These papers and the boxes of of drugs. It doesn't matter which type of document you are translating, you will find from the very beginning that it is written in a way that things don't happen, things may happen, things should happen, things should not happen, as things would happen. It's always written like that. And I don't know about many other languages, but I know very well my mother tongue, which is the Spanish, and in the Spanish we don't speak like that. No, of course we don't speak medical Spanish. Of course we don't speak like that. That's what my focus today. What I would like you to take home, the main advice. Remember that although English medical texts are plagued with with defective verbs and modals, they don't always have a translation. Most of the times, we don't have to translate that verb, but the idea it conveys, the idea it's bringing. Which I will show you a few examples at the end in the next 10 minutes. So defective verbs, you know what they are. Sorry if you knew that. This is very basic English, but I needed to start from somewhere, and you have it there. Those are defective verbs. Can and must are among the most common defective verbs in English, and we can start here. We can start here. Can and must express an ability. You're able to. Remember that the future of can is effective among other reasons because it has no forms in future. Can always implies you are able to. When you can, that you are able to. That everything allows you to do wherever. I can drive, which is not a very good example. Is I am able to drive. I have that ability. I have to study. And the must always is an obligation, right? And an undeniable obligation. You only have the possibility to do that. You must study this book if you want to learn. You must leave right now if you want to reach your plane. So this is the definition of the defective verbs and modals, and of course, probably you know the difference between defective and modals. Not all modals are defective, but defective what? These things are grammar, and this is not my expertise. So I will just let you know what you see in the slide, and go ahead to the next one, which you can find if you study them deeply. You can find lots of aspects of each of the forms, and the positive form and the negative form, must and mustn't, have to and don't have to. And when you are talking in general English, in the colloquial register, when you're talking about how you speak English outside the medical register, there are lots of minor differences between using one of the or other. Some express possibility, some express a bit, something more. It's a bit more possible than. Some express enormous possibility of things to happen. Some express a very little possibility. It's supposed, for instance, if something may happen, it means that, well, there's a good chance that it would happen, but it might happen. The possibilities are less. This is always in the colloquial register, right? In medical English, it's different, and I will try to show you that different there. You can, I don't know, I'm taking a caption of this slide if you're interested, because it's well written, and I think it's more or less clear. It's the clearest I found, and of course you can see there are only a few of the modal verbs. It says at the beginning modal verbs 1, and say can, can't, could, and take a caption. You have had the opportunity, because I'm going to the next. There are defective verbs in every language, or most languages. In Spanish, you have this is the list of Spanish verbs, and see what happens. Defective verbs in English always refer to the possibility of something to happen, or to your ability to do things. That's what defective verbs are in English. The definition of defective verb is that it's a verb lacking some tenses, right? That's a definition in English, in Spanish, in Italian, and in Chinese. Well, in Chinese, I don't know. In Spanish, in Italian, and in Spanish. So these verbs in Spanish, as you can see in your screen, lack some tenses, right? But they have nothing to do with the possibility of things to happen. So when you compare English to Spanish, remember that although they share the definition, defective verbs, verbos defectivos, which is something like, harm verbs, not verbos defectuosos, but we could say that in Spanish also. It means that they are lacking some of the tenses. And you have here the list of Spanish verbs, which maybe you know some of the verbs: acaecer, atañer, balbucir. Balbucir. Can you think of how you say the present tense and the first person? Yo balbuzco, or yo balbuceo. balbuceo. Concernir, and you have verbs I have never heard of, like usucapir, which is a verb, a Spanish verb. Look at these defective verbs in Spanish. Most of them are of the third conjugation. We have three conjugations in Spanish. Those verbs ending in ar, r. Those verbs ending in er, er, and those verbs ending in ir, ir. As you see, most of the verbs here finish, in the third conjugation: balbucir, concernir, colorir, empedernir, fallir, guarnir, usucapir. Well, that's all the grammar part of the defective verbs. I'm not an expert. I only just wanted to know I only wanted to let you know about the definition, which is the same in all languages, and the differences. No? In English, they are all related to the possibility of things to happen. Ranju Kumar Day is all set to do translation in Spanish, Portuguese, Dutch, Afrikaans, and English. Congratulations, Ranju Kumar. I would like to see you roll the translations into Spanish, because do you know what? Sorry, Ranju. I'm sure this is nothing personal, but okay. I'm sure that you're good, very good translator into all those languages. But personally, I'm probably in companies, they will not trust translators who speak too many languages. I wouldn't say that four is too much, too many. I don't know, but maybe you should let your client know that you are specialized in one pair of languages and also available in other pairs of languages. This is an advice for I will be 60 years in September. I've been more than 35 years working as a translator, and please forgive me to share my experience. If you write to company, I've been to many companies hiring translators, and if you hire to a company and you say, I translate from 8 languages into 16 languages, next, we don't want you, because that's how we work. So please, is my advice, Ranju, that Day, I don't know, because maybe your number is Day. Remember, when you're offering to a client your services, remember to say, my pair of choice is this one, and I'm also available in these other pairs of languages. See in the last line of this slide that you say no matches with defective verbs in English. Remember that defective verbs, they share the definition, but they are different. And now let's go with examples. I will need. Thank you, thank you. During the last 2 weeks, I've been advertising this presentation now, and one of the sentences I asked for a translation. I said, "Are you able to translate these? Are here." See the first sentence. We are talking about may, as you can see here. We are talking about may, the effective verb may, and you say. Patients are reading an informed consent form. They are reading that and they find this sentence. And you, translator, find this sentence. You may be reimbursed for traveling expenses. And what does that mean exactly? It means that there's a possibility that your traveling expenses are reimbursed, but they may be not. And the patient should know very well if they are going to be reimbursed for their traveling expenses. I don't know how things work in your countries, but here in Spain, there are large areas of the country where people live in small villages, and the hospital is far away, maybe 2 hours driving, 3 hours driving from where they live. So if they enter a clinical study, they are inscribed into a clinical study, and they say, okay, of course, they need a clinical trial because they have cancer and they are really very bad and there are no solution for them. So the doctor says, let's try this. Why don't you try this clinical trial? This drug is promising. Maybe it will help you. And they say, okay, I live in this small town, this city, small town in the center of Spain, but I will go 52 times to the hospital during 2 years. I have to go to 52 visits. That means that every Monday and every Wednesday during 2 years, this person has to ask for a work leave, get a car if they have a car, use the time to go there, wait a lot of time at the hospital until they have received that doctor who says, okay, we begin today, have the pill, see you next month. That happens, and they have to park. They also have to pay for the parking and the way back, and the money they haven't gained that day. They haven't won that day. They need a reimbursement of that. And what they find in the informed consent form is that they may be reimbursed or not. Well, you have to investigate here, sentence later. You have to investigate. If you have ever the chance, it's not a very available chance, but because of my position and a medical translation job, I have the opportunity to interview patients who are in clinical trials, who are participating or have recently participated in clinical trials, and to ask them about their expectations when they signed their informed consent form and what they found there. And they always complain about this. I am not being reimbursed for my expenses, for my traveling expenses. I'm not, even if I spend a night, because what they do, if they have an appointment very early in the morning, they travel the day before in the evening and they stay at a hotel, so that should be reimbursed. Most of the times you will not know as a translator if the company, the CRO, is reimbursing them their traveling expenses. So you will have to you need to translate the sentence into your target language with the ambiguity, with this state of you may reimburse or not. You have to transmit that. Because you may be reimbursed for traveling expenses. Sounds very well in English, but it's not clear if I will get the money, which is what the patient wants to know. So try to investigate that. Try to know that. Try to know if patients are actually that off, or if the company doesn't want to say it, and then you will have to keep the ambiguity. Look at the second sentence. Again, the patient is reading the informed consent form, and they find you may withdraw from the study at any time. You may withdraw. You have the possibility. There is an option. That's what I want to say with this may, completely different from the other. There is an option. Of course, we are talking to you about participating, and we are giving you all the data and information you need to participate and to take part, and what you will do, what you want. But remember, you have an option. There is an option which has to be very clear. It's not in bold and in italics or nothing. It's just there like another sentence. You have the option to withdraw whenever you want with no explanations. You just say, I'm leaving, and you stay there, right? So, and you have to express that in your target language. Because if you just translate may, you puede retirarse en cualquier momento. Existe la posibilidad de que something like that. I would find it more accurate. See the third example. Information about your medical history will be collected, some of which may come from review of your medical records. Your medical records is what we call in Spanish your historia clínica. Your medical records is, I think, it's like a big box, right, where everything, all your medical information is contained. Think it like a big envelope or a big box, something, and there you have, of course, written papers with all your what you said and medical appointments, but also your X-rays, your echographies, your surgical notes. It's all there, and of course your personal data. where you live, where your age, your numbers, also social security, your personal data are also there. So letting people to watch your medical records is something delicate, which you should avoid as a patient. Always try to protect your personal data, which are in your medical records. You always have to avoid that. So here, you're reading in consent, they inform consent, and they say suddenly, "Would we will be collecting information, and maybe we will look into medical records." Excuse me? I would say, excuse me? No, I don't want you to look at my medical records. You get all the information, the medical information you want me, but you're doing me tests, you're doing me exams. It's up to you to know to decide if if you have the information you need. But I don't want to share my personal data with you. That's important in our world, in our current world today, and it's not something without importance. In the fourth example, you may answer the questionnaires by using a personal device. Again, there is a possibility you can answer the questions with this e-diary which we are providing you, but you can also use your own tablet or your own PC or your own, and of course, I will answer to your questions in 5 minutes. 5 minutes. That's what I need. So again, try to convey that information into your target language. There is another possibility. You can use your personal device and make it clearer for the patient. The patient is reading. I don't understand how informed consent forms are 12 pages long, 18 pages long. But it should be very easy. No, this is I don't accept this or this or this, like the cookies. No, when you go to a website, like the cookies, I accept this, I don't accept this, I don't want this. And what happens is that most of the most important things they want you to accept go there unadverted. They are in text, and they go there, and you're reading and reading. Okay, okay, okay. I will. It's a very long document, and it's somehow planned to um, not to say things clearly. We have here another. Maybe you can. By the way, I forgot the light today, and we have a storm right now here. I don't think that we have any problem. Listen to this. The next sentence. While completing the questionnaires, there is the potential that some of the questions might be upsetting or distressing to you, or may cause emotional or mental discomfort. Do you really need the patient needs this such a um, differentiation? Making clear you may suffer upset, you may be distressed, you may suffer emotional discomfort or mental discomfort. What does it mean, all this? Well, it's only that there are maybe personal questions, sensitive questions, delicate, we say delicate questions about your sex, about your sexual activity, about how many times do you have sex a week. That's what they mean only. No, maybe, or maybe which is the color of your feces. When you go to the toilet, which is the color of what you leave in there? Which is the color of your urine? Does it smell? Um, that mean that's what they mean there. So why not? Some of the questions may be unpleasant to answer. Usually they say don't answer them if you don't feel like. But again, the verb is may, and the meaning is completely different. And just the again, uh, your doctor or sponsor may also decide to withdraw you from the study at any time, and that means that even you have been reading these questions, and your rights and everything. The study doctor, or the sponsor may withdraw you at any time without explanation. You are no longer in the study. Bye bye. Have good luck. Talking about can now, the second. Have you heard the thunder? The thunder is the one you thunder. There's been a one. With can, you say, for instance, you can also discuss it with your health team, Of course, I can discuss it with the health team. Can you imagine the opposite? Can you? This is the kind of sentences which, in my opinion, are really unnecessary in informed consents. There's no possibility that they would say you cannot discuss the product, the informed consent or the procedure or the drug you're receiving with your health care team. Can you imagine that? Of course not. This is absolutely obvious and superficial. So, but again, you have the possibility, and it hasn't changed me a lot from may to can. In the second example, you will find a very common sentence in informed consents, which is this website will include information that can identify you. I'm sorry, but the information can't identify you. Hello, I am the information. I am identifying you. No, that is personalization. It's attributing human properties to unhuman items like information. What you really want to say here is that this website will not include information that allows to identify you. Información que permita identificarlo. It's not información que lo identifique. No, the information will not identify you. Information will allow to identify you. And third example here, you can take part now and later drop out, and it won't be held against you. Of course, this could be translated very well, ¿no? Usted puede apuntarse ahora y marcharse más adelante, darse de baja. You may take part now, say now, okay, and later change your mind and say, you know what, I will not take part. I am not interested, and that won't be held against you, sin consecuencias. Sin consecuencias. It will have no consequences. And here's the end for today. Should, we have 4 examples. What should I know about the study? Why should? Because that's how they say things in English. What must I know? What have I got to know? What do I have to know? ¿Qué tengo que saber? ¿Qué tendría que saber? If you try to translate should in Spanish as a conditional verb, ¿qué tendría que saber? What should I? No. See the second example. You should talk to your doctor about any side effects that you have while taking part in the study. If you analyze this should from a grammatic point of view, it means that, well, talk to the doctor if you want to. No, they are not saying it's compulsory, and we are talking about side effects. Of course, you have to talk about side effects with your doctor. So, when translated into your language, give an order, say an imperative. Talk to your doctor if you have side effects. Forget about the should in English, right? I hope you're getting my intention. We're about to finish. To help you to decide, you should understand. To help you to decide, you should understand the study. No, reading the sentence, it seems that if you don't understand the study, it's okay. You should understand it, but if you don't, no problem. We will go ahead. And that's not the meaning in English. Although they are using should, what they want to say is to help you to decide, it's important that you understand the study. There is a lacking understand in there. Let me correct that in a second, please. Here, that you understand. Good. Sorry about that. So I hope you're following my thread. Let's to the third example. You should complete the questionnaires. This is the situation. You have a patient, and you say, well, along the study, at the same time that they give you the pill and make you test, that you will every day go home and answer a questionnaire. How many times have I gone to the to the toilet, how many times it was productive, let's say, how was the color of the, you have to answer to questionnaires, right? And they say you should complete these questionnaires at a specific intervals. It seems that there is a possibility that you don't complete the questionnaires. Well, in a way, you should complete. Well, I should, but I can't. I am today. I was busy. No, please complete. Please complete these questionnaires. We want to convey the idea that it is compulsory, that you have to complete but we won't say that because we want to the patient to feel relaxed, right? But the true information there is that please do your best to complete the questionnaires, right? So if you try to translate should as a defective verb with possibility of something to happen, you may complete them or not. You are not doing well. And the last example and the end for today is you or your healthcare insurance provider should pay. Remember, you always find in an informed consent form, you always will find what the sponsor is ready to pay and what they are not ready to pay. They say it very clearly. We will pay for this, this, and this, and we will not pay for this and this and this. And remarkably, they will not pay for a lot of things, too many things, in my opinion. Of course, that's the United States. In Spain, everything is free, is for free, and besides, many times you get paid for participating in a clinical trial. But in the United States, note, they will only pay for procedures or harms or injuries directly derived from the clinical trial, and they will decide. They have a team to decide if your injury is directly related to the clinical trial. So make sure that at least ask, what do you mean? Will you pay, you a sponsor, Mr. Sponsor, the doctor who is explaining to you the informed consent? Will you pay for instance, if I have a traffic crash? Imagine that while driving through here to the hospital, I have a traffic accident, a crash, and I'm injured. Will you pay for that? Will you pay for my surgical intervention, for my therapy, or will you not? That's important. That you should make clear it. The fact is that in English they say your health care insurance provider should pay the cost of any treatment for your disease that you would receive whether you were in this study or not. That may be logical, and sometimes, while reading it, your ethical conscience will say, this is not clear. If you cannot learn from the sponsor or whoever what is going to happen in real life, then you will have to convey the ambiguity. It's not clear. Not with these words, but you have to convey the idea to the reader that it is not clear who will pay in case you become sick and ill or injured. And that's all for today. I don't know. This is again a mistake. Sorry. The next is not in April. No, we are going now to May the 10th. Sorry. May the 10th. I will change it here. Sorry. Well, thank you. Thank you, Alfonso. May the 10th. No April. May the 10th, we'll have the next session. We will talk there about baseline and basal, the translation of baseline and basal, which is wrong in most dictionaries. Even in my another personal sponsor, I have nothing to do with translators up to now. Is Cosnautas, which is a website of medical dictionaries, which is wonderful, and I will talk to you another day. But although they are not they sponsor me a bit personally. They sponsor me a bit. They are wrong. The dictionary is there about baseline and base, which, as you know, you find all the time in medical English. You will find these two terms, baseline and base and basal. So that will be the pill on May the 10th. If you are so kind to join us at this time, you can send comments or questions via our chat. And but it seems that you are not very interactive. So, but anyway, thank you for attending today. It's been a great pleasure. I hope you've got some clear ideas about effective verbs and how to translate them. Remember that you are entitled to translate the information in English from into information in your target language, and the information in English may be misleading because of this should, would, could, ought to. Don't be top there, and always think, because I'm writing in one of my books, empathy is the main characteristic, the main quality of the good medical translator. The ability to put yourself in the patient's shoes and try to translate from there. And you are at the side of the patient, and you're able to translate for them. So thank you very much. Yes, Ramona. And next session will be at the same time, 4 p.m. Central European time, and we will talk about baseline, the translation of baseline and basal. Thank you very much to all of you. Thank you very much to Alfonso and TranslaStars for this magnificent opportunity. Please don't forget to visit GuestPoint website. You will find it interesting. Above all, don't forget to visit TranslaStars website, where you will find satisfaction to all your needs as a medical translator. Have a nice day. See you next month. Bye bye.